risk of transmission for certain groups. So short-term solutions related to the pandemic response, yes, we want to test more people. We want to link people to social support services. But the real factors that are going to change and bend that curve on a long-term scale are looking at the systemic factors that drive that. For example, testing is important. So we've got ready responders that have gone in physically to homes to test folks. That's great, and we're identifying cases quickly and isolating those people effectively. But the long-term issue is, why is it that we have seen so many instances where we've got into places where we've seen multiple families living in one-family dwellings? What's the systemic factors that are driving that, and how do we fix that change? We've encountered a lot of people. For example, we built our mobile helpline for individuals who don't have access to a primary care provider and access, whether it's their insurance status or other issues. What are the systemic factors, and what's the systemic change that needs to improve or happen to be able to increase access to health insurance and access to primary care providers and rebuild that trust within that system? So there's a whole host of systemic factors and systemic change that needs to happen that I am hopeful will continue to be a part of the conversation and supplement any of the short-term solutions that we put into place to address the public health aspects and components of this pandemic response. I will stop there, but as always, happy to answer any questions that you all have.
Thank you, Dr. Gales. We're going to shift now to Dr. Stoddard, who wants to share a little bit of news about the business community in Montgomery County as it's handling this pandemic. Dr. Stoddard.
So, as I think we've alluded to, I think that obviously one of the core things that we're doing now is making sure that the things that are open right now are operating in a manner consistent with good public health practice, that not only are our residents protected when they visit these businesses, but the employees themselves inside these businesses are also protected. We are obviously going out and doing both education, and we had the ambassador program that did more than 2,000 businesses, original visits, but also another 900 or so follow-up visits with businesses to just make sure that things were going as needed and providing PPE and education, and we've gotten really good feedback on that. On the other side of it, from education, we've also been doing some additional enforcement. We talked about a handful of locations that were cited and or closed as a result of violations that were found, particularly over the holiday weekend. We continue to receive, I think, the Health and Human Services inbox had more than almost 70 complaints of various business concerns yesterday alone over the last 24 hours. And so, obviously, our residents are extremely concerned about their own safety and have been providing us information about what's going on in our business community. Now, I do want to say very clearly, the vast and overwhelming majority of our businesses are doing exactly what they're supposed to be doing. We have gotten good compliance from our residents inside those businesses and from the business owners and operators in the overwhelming majority of cases. It is only a handful of people who have chosen to put their personal business profits over public health, and it's those cases that we've had to intercede and prevent things from proceeding as they would normally. So obviously that's an area where we're going to continue to provide some focus. We've got a good partnership through what was normally our safety alliance that was thinking about things like underage sale of alcohol. They're thinking about things like COVID-19, and we have a partnership between our Health and Human Services, alcohol beverage services, environmental protection, permitting services, the Montgomery County Police Department, our municipal partners, the Office of the County Attorney, the State's Attorney's Office. I heard from Mr. McCarthy yesterday, and sort of we were working collaboratively to identify mechanisms where we can just incorporate both education and enforcement into one strategy, and that's exactly what we're going to do moving forward. We cannot and will not allow a handful of irresponsible businesses to ruin it for the entire business sector, and we don't want to make holistic changes or go backwards in a way that hurts our residents and our businesses. If we can absolutely avoid it by having those people who are not following the rules follow the rules. We're simply looking for everyone to follow the rules that have gotten us to where we're at now. So I'll stop there and return to the question.
All right, thank you all three for your remarks. We'll shift now into reporter questions. We'll begin today with Chris Gordon from News 4 with a question for both the county executive and Dr. Gales. Go ahead, Chris.
You're on mute.
All right, I'm on mute. Hopefully you can hear me now.
Yep.
I'd like to include Dr. Stoddard in this as well. Now that you've mentioned it, I understand you've been under some pressure to start phase 3. You county executive made clear we're in phase 2 and why we're in phase 2. But A, have you been under pressure to start phase 3? And B, what are you going to do about businesses? I guess the specific would be the grill at Flower Hill, where the owner is telling his employees not to wear masks.
So I'll answer part of the question. I mean, I'm under more pressure from people not to open than to open. I get far more mail from people, particularly different people, in encouraging us to continue to be cautious and be careful about opening. That is typical of what I see. And while there are a number of people who write repeatedly and may well want to fill up my mailbox, the general comments I get from people is, please be careful, please keep us safe, and we don't want to be like the states that are having to shut down again. No one wants that spike. Some people say, well, it's not really that big a death rate. Well, it's not big a death rate until you're the one that dies or somebody you love dies. And there are a lot of folks who don't buy that as a rationale for opening. And the other side of that is there are a lot of people who wind up with impairments and longer term dysfunctions as a result of this, that, you may not be dead, but you may have health consequences that endure beyond your immediate recovery. And the expenses associated with this for people are enormous. So there are lots of reasons to be careful, and we're going to continue to be careful. I don't feel the pressure to reopen.
And what do you...
Dr. Did you want to hit the business question?
Yes, I wanted to ask them each on the business question. I mean, we have one specific, the grill in Flower Hill, which I guess is not open until tomorrow, Thursday through Sunday. What are you going to do about that?
Well, I'll start, and certainly Dr. Gales can add to this. Obviously, I don't want to go too much into the individual enforcement in one particular business, because obviously we could face there could be legal issues associated with going too far down the road of explaining a particular action that hasn't actually taken place yet. So you're correct in that case. They are not open today. They'll open tomorrow. We're well aware of what was posted, and we're obviously not going to permit a business to operate in that manner in Montgomery County. And to be very, very clear about this, what was referenced in that particular case and in other cases that we have seen is a violation not just of a county executive order, but also state law. And so it is not simply that Montgomery County is going to be overly harsh on our business community, and in most cases, most cases I think we've dealt with, it has been a violation both of county and state ordinance that has led to the actions being taken. But I think I don't want to foretell exactly what necessarily the inspectors are going to find when they go out there tomorrow, as I can easily expect that they will. But the key point here is that business or any business that is going to overtly ignore the public health orders faces citations and closure, both potentially from things like that, and it can extend into things that affect their licensure to operate as a business overall. And so I'll stop there, and Dr. Gales can certainly add on.
I don't think there's much to add other than to say, as a tie to both of the questions that were asked, is that press is a privilege, and it's a privilege to be able to represent and look at the health for all of the residents of Montgomery County. And so yes, we do receive a fair amount of mail from people who second guess or question how we're moving forward and are asking and pushing to make provisions and changes to what we're doing. But we also understand that that is a vocal minority, and the majority of folks that the county executive mentioned have asked us to continue to be thoughtful and careful and use data and science to guide how we move forward. And every step of the way, we've looked at the data and information to inform the types of activities in terms of what's being allowed and how to move forward in terms of what capacity limits and restrictions are put into place. And I can assure you, to the 1.1 million residents of Montgomery County, we will continue to do so And not only that, we'll look at it from a local perspective. We also will continue to keep an eye out on other jurisdictions because, again, that could impact us in terms of folks moving back and forth across our borders. But we also will continue to look at other jurisdictions for any best practices or strategies to implement to further drive down the burden of transmission in our community.
Thank you, Dr. Gales. Kevin Lewis with ABC7 News has a question for the county executive. Go ahead, Kevin.
Hi, County Executive. Sources are telling me that multiple county departments are being asked to find places to cut in the budget because of COVID-19 shortfalls. What can you tell me about that? They're saying that it's coming from your office and that cuts could be anywhere from single digits to double digits.
That's an odd question. First of all, the council wanted us to generate a savings plan, which we were going to do anyway, and it's not because of spending on the coronavirus. It's because our tax revenues are definitely not going to be what had been budgeted. Between the losses of income, we know that this year we'll have a reduction in income taxes. Not immediately, because people's taxes are based on what they made up to the end of 2019, but withholding is down substantially, which is an indicator of people's incomes, and so we're getting less withholding than we anticipated, and we anticipate reductions in property taxes and a number of other things, and so we've got to make accommodations, and we've submitted a plan to the council, and it's pretty substantial, but we asked for departments to recommend up to 6%. We did not necessarily take all the things they recommended, and in particular, in Health and Human Services, we pretty much left programming alone. That was the last place we were going to go, and we're not going there right now. We have, talked with the school system. They've done this before. This is not some new thing. There were multiple times when I was on the council when the school system provided savings, usually later in the year and usually from money they had not spent. Though I will tell you there are times when they've done things like frozen hiring teachers and relied on, substitutes in order to create savings that the county's used in the past. So there are multiple ways to go, but we did not ask the school system to provide any savings right now because we don't really know, and they don't really know how this is going to affect their operations and how much their operations will get covered by federal stimulus money. So there's no point to push this at this moment. We feel pretty good. We have pretty substantial reserves. We're certainly going to most likely use reserves to cover part of this. I have said from the beginning that I do not want to and will not dismantle the county government and cut basic services to people in order to keep reserve numbers untouched. That's the whole point of a reserve, is to be able to use them when you have a crisis. And if this isn't a crisis, I don't know what is. So I think we're actually in fairly decent shape, and we will make some cuts. But a lot of the cuts, the ones I've seen, are money we're not spending, and money we know we're not going to spend. For example, because certain operations won't be reopening. We have major cuts in fuel and in terms of heating and air conditioning buildings that aren't going to be fully occupied in the next month or so. So it's flexible, and yes, we asked for it, but we asked for it, and the council asked us to bring it to them. So, which we were going to do anyway. So this is part of a process in which both the executive branch and the council are engaged in. They get to look at the cut list, and they can decide which cuts ultimately they want to make and which ones they don't want to make.
Thank you, sir. Brianna from Bethesda Beat has a question for both the county executive and Dr. Gales regarding testing. Brianna?
Yeah, thanks. So I had a question regarding testing. County council members have recently voiced their concerns that there isn't enough testing that's being done, enough testing sites being opened, and enough people being reached with information about testing. And I know yesterday afternoon, a couple council members sent County Executive Elrich a letter requesting a testing strategy plan be put in place. And if there isn't one, then they're going to do it as Board of Health. So what's kind of your response to that?
They will get a testing strategy plan, which we have. We didn't get to 20,000 tests without having a plan. We've tested more than anybody else in the state, and I think more than anybody else in the region. And Travis can correct me on that, but the last numbers I've seen, we have done more testing than anybody else, and we're going to continue to do more testing. And we've done a lot of that without support from the state that was, for example, given to Prince George's County when the state helped open up a walk-in testing site. That's something the state did not do for Montgomery County, despite our numbers. So we are expanding it. Our biggest problem probably is that a lot of folks do not use media, social media. I would think we overemphasize, for years, social media. And this is really an effort that's got to be done on the ground, and we're looking for more ways to be able to get into communities on the ground, being mindful that this is not the same as your traditional, like I'm just going to have people go knock on doors, because there are people who won't let anybody in, and it's hard to find people who want to walk into somebody's house not knowing whether that person has coronavirus. So this is really challenging, but we continue to look for ways to deepen our reach into the communities, and we intend to do that. We're not resting on the testing that we've done now, either the rate or the quantity of testing. The goal is to ramp up the rate and to bring in more partners and to ramp up the quantity. And that's what we're going to do. And then the department's been operating on a plan. I heard comments about confusing message, but part of the problem is it starts with the state. The guidance from the state until almost a week ago, maybe a little more than a week ago, was you only test people who are symptomatic. And we weren't testing asymptomatic people. We were telling people, or the state's guidance was you tell those people to go home and sequester in place and come see us if they get sick. That was all based on a limited ability to do testing. The governor changed that guidance last week and said anybody who wants a test should be able to get a test. We had started doing that anyway, and we're going to continue to do that. Symptomatic or asymptomatic, we will have a means of testing people, and we will have more partners to do it with.
Dr. Gales, did you want to add to that?
I'd be happy to add. So first and foremost, again, we have had strategies in place to test, the county executive mentioned. We have implemented a diverse cadre, and you all have been privy to those plans and strategies on a weekly basis in terms of updating how we're moving forward. To walk back through history, and again, we're not resting on history. We recognize we still have tremendous work to go, but history informs the directions in terms of where we're moving right now. So we created stationary sites. We heard from them, the feedback we got was the first one, well, it's not geographically accessible. So we created other sites that are tied to the zip codes that have had the most cases. And so we've created 3. Then we heard and said, okay, well, there are individuals who still are locked out of that because they don't have a primary care provider to get a referral. So hence we created a mobile helpline that allowed for people to call in and actually under my name get a standing order to be able to get tested. And then after that, we heard to say, well, we still have people who need to be tested in their homes and can't get out due to transportation. So we work with the state-ready responders to physically go out to homes of individuals, as well as provided support to group homes and other places who needed testing. And we are restarting that process again with a contract that will go live with that same crew next week. We created a mobile test arm utilizing volunteers from Project Hope that has been in place for several weeks now, that is allowed to be able to go on site to places to conduct testing there. And then the other feedback we got was that we still don't have enough options that are geographically accessible where transportation isn't a significant issue. So hence we have created the pop-up strategy, and we've already implemented a number of those sites, and we're continuing to grow, working with community partners to introduce other venues to be able to provide testing that is more accessible to the community. So all of those things do represent a strategy, a very careful, correlated strategy that has been advised by epidemiology and data. And again, we recognize we still have significant work to go and work to do. Hence, the team is busting their behinds in terms of increasing the partnerships around pop-up testing, identifying new venues to be able to support stand-up test sites that are more geographically accessible throughout the community, that represent a strategy to address the fact that we know that the numbers disproportionately impact Black and brown people within our communities, as well as disproportionately impact certain zip codes. So the notion that we don't have a strategy is absolutely false. And we will continue to move forward and welcome suggestions from council members or others who have ideas in terms of how to increase outreach and penetration through communities. I think it's important to note also, and I want to go back to one of the points I brought up in the very beginning, testing is a part of the strategy. So we want to increase testing, and we also want to be able to isolate as many people as possible, catching infections early to mitigate transmission and reduce networks of transmission. But part of that conversation has to be a real in-depth discussion about the factors that are predisposing certain groups to having higher rates. When we look at household transmission, we know that that's a significant factor. When we look at the types of jobs who have been asked to perform work and go to work in the last several months as essential employees, that percentage of workers who are frontline responders correlates very, very strongly to the number of cases that we have and who is disproportionately impacted. So we need to make sure that in our questions to our efforts to increase testing, we also are having those real substantial conversations that are going to address the root causes that are predisposing certain groups to having more cases. And those are the types of substantial conversations that are going to create the systemic change and the systemic improvements that are not only going to take away the factors that are predisposing folks for having COVID, it's also going to take away the facts that predispose individuals to having adverse outcomes, health outcomes across the board, particularly when we talk about health disparities.
Thank you, Dr. Gales. Caitlin Peets with the Bethesda Beat has a question for you about schools.
Hi, Dr. Gales. I was just going to ask you about schools today. There seems to be a lot of consternation and concern about plans for schools in the fall, especially with what seems to be increasing pressure from federal officials to reopen buildings. I'm just curious your take on that opinion and what kind of guidance you're providing to MCPS as they develop their plans for the fall.
Well, I think the first thing I want to do is applaud the officials at MCPS for the exhaustive work that they have been doing from the very beginning before we even had cases in Montgomery County and throughout this process. They have worked tirelessly and consulted with us and worked closely with us in terms of providing guidance to be able to use their facilities safely, how to maximize their outreach and support to their students within the community and support families. And they're employing those same exhaustive strategies to thinking through how we could potentially reopen schools safely in the fall. So I want to applaud them on those efforts and know that they are working to do that. In fact, Dr. Stoddard and I are going to be touring one of the schools tomorrow morning to look at, some potential strategies that they're thinking about putting into place should schools reopen. Now, as it relates to the federal issues in terms of the policies related to it, forgive me if I'm speaking out of turn, I think it's reckless to come through with mandates that aren't informed by data and science. We simply don't have all the information yet to be able to jump through and say that we're going to mandate and require facilities to be open. I think that what has been evident in the state and evident on a local level is that we've been very thoughtful and very intent on looking at the data to inform whether or not those are wise decisions and smart decisions to make. So that's pretty much all I have to say on that. From a public health perspective, there are significant concerns, and I know that there are lots of strategies that are being thrown out, thinking through how we could potentially and safely do that. And I know that there are a number of other states that are having these conversations, from ranging from Florida, where the governor has said schools are going back August 24th, to the state of Hawaii, who said that they are not going to reopen schools until they've had 4 weeks of no cases. So I'm hopeful that we'll be able to have a national conversation about what's safe. But I do feel confident that officials at the Maryland state level, as well as the local level here in Montgomery County, are looking at the facts and are looking at the data to determine what is safe to move forward.
Thank you.
I'd like to add to that really quickly. We all agree, the American Association of Pediatrics is very clear, there is clearly benefit to having students in schools in terms of an educational and developmental perspective, and we agree with that. But the comments of the President or Secretary of Education DeVos are not going to take precedence over student and staff safety in our school buildings. And so we are working very closely with the school system to try and find a safe environment that will allow us to move forward with education in the classroom. But frankly, the numbers, as we've said this many times, the numbers will drive our ability to do that, school system's ability to do that. And so, to be very clear, safety is going to drive what happens in the fall, not political rhetoric.
We'll end it on that note. Thank you all for joining us this morning. As always, this session will be shared on our Facebook page as well as on our Twitter account. So if you've missed a portion of this, feel free to check it out there later this afternoon. Thanks, everyone. Stay safe and stay healthy. Take care.
Thank you.
To the Village to Village Network. Here in Montgomery County, Maryland, there are 23 active villages and 10 in the works.
Villages are local grassroots organizations set up by community members with the vision of creating a better place for people to live in. AARP study indicates that more than 90% of people want to age at home, but that requires some thought into it. Things don't just happen spontaneously. So they intentionally